Thank you for tuning in to this week's episode where we'll be discussing eyelid rejuvenation, learning more on estate auctions, and discovering the medical benefits of dancing. All right here on Aging Gracefully on Suncoast FYI. Dr. Sessa joins us this week to discuss eyelid rejuvenation. And welcome back.
Thank you.
Nice to see you again.
Nice to be back. Yeah.
This week we're going to talk about eyelid rejuvenation, and that entails eye lifts.
Yeah.
And skin removal comes along with that, right? You don't just put the eyelids up with.
Right. Sometimes it does. Yeah. Sometimes it does. Sometimes it doesn't. You know, one of my favorite eyelid rejuvenation procedures is just removing a little bit of fat from underneath the eyes. Mm-hmm. And, you know, because sometimes, you know, you look in the mirror and you see puffiness, or, you know, who doesn't have some puffiness under their eyes, right? So a lot of times that's fat falling out. We have ligaments around our eyes, and as we get older, they loosen. And as they loosen, the fat that sits under your eye starts to push outwards. Mm-hmm. And a lot of times it's very simple, no scars on your face. I'm able to sort of remove some of the fat that's pushing out.
Okay.
And then I use the laser that I rejuvenate skin with to laser over the skin on the lower eyes.
Okay.
And that has a skin shrinkage effect. Okay. So rather than doing surgical procedures where I'm cutting skin, removing skin, contouring muscle, removing fat, I can get the same result with much less surgery. So it's a much more conservative way to treat the lower eyelid, especially if you have loosening of the ligaments around the eyes.
Which everybody does when they get older.
That's right.
So that would be for the lower part of your eye. What about the upper part?
Yeah. So as far as the upper eye goes, you know, a lot of people sort of come in and say, well, you know, I have the skin hanging down. Some might even end up at eye doctor offices saying that they're having difficulty with visual field loss. And that's important because if you're driving, you need all the visual fields in order to drive safely. So if that's the case, the standard upper eyelid is done where you can remove the excess skin, heavy eyelid look. You know, we make a very curvilinear incision hidden inside when you close your eyes. You can't see it when your eyes are open. And you remove a little bit of the excess skin, you remove a little bit of the excess muscle, and then it's all closed together. Very, very mild procedure, very low risk, very little bruising. 2 to 3 days at most of some mild recovery. But most of these procedures are very, very well tolerated, and they make the world of a difference. If you look at studies, when they say what ages you the most when you look at a photograph, the two things are your eyes and your skin. Those are the two things that tell your age, other than your hands, if you have sunspots all over your hands. But if you think about that, that goes hand in hand with, if you look at a list of the 5 most common cosmetic procedures performed, eyelids are always one of the top 5.
One of the top, sure. Yeah. Now, again, downtime. What kind of downtime is there? And again, when I say downtime, I mean that's, you know, recovery time. But how soon before you may actually want to be seen in public after you have something done?
So, you know, typically, anytime you have any injury, whether that's surgical injury or you fell down and bumped your knee, you're going to have 3 days of some swelling. Generally, at 48 hours, the second day, is the greatest amount of swelling, and then after that it goes down. So typically 4 days, 5 days. By that time, most everyone, the swelling has reached a point where it's not unsightly, and you can be free to go out. The nice thing about eyelids, is you can wear eyeglasses
Wear
or
glasses,
sunglasses.
right.
So you not only look cool, but you're the only one that really knows you look better
Yeah.
underneath your
Yeah,
glasses.
great. Now, all of these procedures that you do you do these in your office? Do you do them in a hospital? And how is that all taken care of?
Yeah. So, great question. So, all of the cosmetic procedures that I perform, whether it's facelifts, eyelids, breast reductions, tummy tucks, they're all done in my surgical suite, in my private facility. So I have a private surgical facility within my office. That's quite large, actually. And this is regulated by the Florida Board of Medicine, which is a regulatory body. Operating in an outpatient surgery center in the state of Florida is very difficult. It's wrought with regulation. It's not anyone can just hang up a shingle and say, I'm going to start doing surgery
Right.
tomorrow.
Right.
There are procedures, reams of paperwork that are necessary. Once a year, somebody from the federal regulatory body comes to my office, looks through all of my procedures, looks through my facility, makes sure that it's at the highest standards of care. So rest assured that I have the same standards that you would have in any ambulatory outpatient surgery center
Great.
and or hospital. The only difference between my facility and a hospital is that the hospital is associated with a hotel, if you will.
Right. Right. Well, that's great. I mean, that's so much more personable too. I
Yeah.
think going in and having that experience with your
Sure.
patients. Well, again, thank you for being with us, and we'll see you next week.
Thanks again.
All right.
Bye-bye.
Aging Gracefully will return in a moment.